Okay, here we're going to talk about a little quirk in data that's kind of interesting and doesn't show up frequently, but does show up. So please pay careful attention to this. It's known as Simpsons Paradox. And it arises when two or more subgroups are combined to form a single group, and there exist significant differences in the size of the subgroups and the proportions, which appear causing the combined grouping to appear to contradict results from the individual groupings. But what's really important is to know that there's significant size differences. So differences in sizes can cause this problem. So consider this. We have the surgery rates of two doctors, Dr. Fix and Dr. Patch. All right. And when we look at the survival rates, 60 over 190 is 250 and 50 over 200 is 250. And so those are how many died and how many survived. And if I look at the survival rate, it's 190 over 250 is 0.76 versus 200 over 250 equals 0.80. So when I look at this, I go, Dr. Patch has the higher survival rate because 80 is higher than 76. I'd like to go to Dr. Patch. I feel much safer with that. Well, let's look at the information a little further. So 8 and 52 sum up to the 60. And I want to show you that these two tables combine to make that single table. 8 and 52 combine to make 60. 17 and 33 combine to make 50. 60 and 130, 190, 120 and 80 is 200. So these two tables make up that singular table. So based on this information, whether or not a patient was in good condition or in poor condition, to whom should you go for? Well, when I look at the good condition, turns out that 60 out of 68 survived for Dr. Fix, and 120 over 137 survived, or 87% survived for Dr. Patch. Well, okay, if they're in good condition, if you're in good shape, it appears that Dr. Fix has the higher survival rate. I'm going to Dr. Fix if I'm in good shape. Okay, but what happens if I'm in poor condition? Well, if I'm in poor condition, it's like, well, 130 out of 182 versus 80 over 113. Well, once again, Dr. Fix is better. Well, if Dr. Fix is better, I shouldn't be choosing Dr. Fix. But up here, we chose Dr. Patch. And remember, these two tables make up the singular table. So what happened? Why did this happen? Because Dr. Fix has a better survival rate for patients in good condition and those in poor condition. Well, the reason is, look how many patients Dr. Patch has, or Dr. Fix has, in poor condition. So Dr. Patch has lots of good condition, Dr. Fix has a lot of poor condition. And because those table values differ so much from one quantity to another, this is twice as much as this, and this is a lot larger than that, it appears up here Dr. Patch is better, but down here we go, oh, you know what, Dr. Fix is clearly. So this is an example of Simpsons Paradox. The cause of the problem is due to a masking or lurking variable. And in this case, the lurking variable happens to be the health of the patient, right? The health of the patient is a lurking variable here that drives it. So if Dr. Fix had more healthy patients and fewer unhealthy patients, it would be clear up here in the first table. But since he doesn't, it's hidden. So this is what you need to star. This is probably the crux of it. It arises when the numbers in each subgroup are significantly different and alter the proportions in the subgroup. All right. So when the subgroups are significantly different, in this case, Dr. Fix operates on many more patients in poor condition, and that group has a lower overall survival rate. All right. That concludes that.